Now, let's take a look at one of the special studies, MR myelography. MR myelography is an imaging technique that allows us to evaluate the nerves in greater detail. According to a paper published in AJR in 2002, MR myelography provides additional important information compared with conventional MRI. A study published in 2004 also reported that performing MR myelography together with conventional MRI offers additional diagnostic information in many cases. At Wooridul Spine Hospital, our MR myelography is presented in a 3D format like this, and we also provide coronal myelography, which allows us to assess surrounding structures. This produces images that resemble the operative field. This is another myelography sequence that visualizes the surrounding vessels through a different imaging setup. To compare conventional MRI and MR myelography, you may think of conventional MRI as seeing the forest, while MR myelography allows you to see the trees. Next is the axial loading view. Disc loading changes depending on posture. When you are standing, the disc bears nearly 100% of its load, whereas when you are lying down, the load decreases to about 24%. This is also why patients with lumbar disc disease often feel better when lying down. Because conventional MRI is performed in the supine position, it does not fully reflect the disc condition under standing load. This explains why some patients experience severe pain when standing, yet their MRI findings appear normal. The axial loading view uses a special device that reproduces disc loading, similar to the standing posture. According to a study published in 2023, the axial loading view accurately reflects the disc condition under standing load. Here is a case of a 55-year-old male patient. Both conventional MRI and axial loading view were performed. Compared with conventional MRI, the axial loading view demonstrates more prominent ligamentum flavum hypertrophy and more severe central canal stenosis. At L5S1, the axial loading view also shows more distinct ligamentum flavum thickening and a clearer disc protrusion. Next is the dynamic flexion extension MRI. According to a study published in 2022, dynamic MRI plays an important role in evaluating compressive cervical myelopathy. This is a 50-year-old male patient. On conventional MRI, there is mild compression at C3 to 4. However, the extension MRI shows significant spinal cord compression along with signal changes. Next is the foraminal MRI. Cervical nerve roots exit at approximately a 45-degree angle. Because conventional MRI is taken at 90 degrees, the cervical foramen and nerve roots may appear oblique or may not be clearly visualized. Foraminal MRI is obtained at approximately 45 degrees, providing a clearer view of the exiting nerve root. In a paper published in 2015, foraminal MRI was reported to be very useful in diagnosing cervical foraminal stenosis. Here is a 49-year-old male patient. Compared with conventional MRI, foraminal MRI demonstrates the foraminal disc herniation more clearly. This image also shows that the foramen and the exiting nerve are better visualized on foraminal MRI than on conventional MRI.